Welcome everyone, Dylan Gemelli here today with a brand new video for you. So this is a pretty highly requested video that I've been getting a lot of requests for lately. So we're going to talk about Proviron today, but first and foremost, let me remind you that I'm not a doctor. I am not encouraging nor advising you to do anything, any sort of drugs, any illicit activities whatsoever. This is for your entertainment purposes only, knowledge that I've gathered over the years, and that is strictly it. So what you do with this information is completely and utterly up to you. So let's talk about Proviron a little bit today. Now, Proviron, you will also see it called Misteralone. So if you see that, that is just Proviron. Now, roughly about 5% of testosterone undergoes 5-alpha reduction to form the potent androgen DHT, or dihydrotestosterone, which I'm heard many of you have probably heard of. And basically, what is DHT? DHT is a sex hormone and androgen hormone, and DHT actually plays a really major role in the formation of the male genitals, and in adults it acts as the primary androgen in the prostate and hair follicles. Now, Proviron is almost as pure a DHT steroid as you're going to find. All right. So with DHT compounds like Proviron, you don't need to worry about any sort of aromatization whatsoever or estrogen conversion. So let's talk about some medical uses real quick. Now, studies out there have shown Proviron is effective for depression, anxiety, and it also can help to boost a lack of sex drive. Now, it would make sense that those that are bipolar and would benefit from using Proviron, and it's generally prescribed by doctors to men with low libido. Now, in addition, it's a precursor to full TRT, or testosterone replacement therapy. All right, so let's move and shift to bodybuilding. So, Proviron became popular many years ago because it has some anti-estrogen properties. Now, I'll get into why I say properties in a second. So it has a really high affinity to bind to the aromatase enzyme. So anabolic steroid users could use it to help to boost the aromatase inhibitor that they may be using. Let me make something perfectly clear before I move on. Proviron itself should not be used as an aromatase inhibitor. It has properties, like I said, but just because it has properties does not mean that it is a full all-out substitute. Now, it will be able to maybe allow you to dose your AI a little bit lower if need be. That's something that you have to test through blood work, but it's going to help to add to the strength and potency to the AI that you're using. So if you're using Arimidex, 0.5 milligrams every other day, for example, you might possibly, not a guarantee, but there's a chance that you could maybe lower that dose a little bit, because I know a lot of people don't like to dose their AIs high, and some people prefer not to use them even though that we need them. But it basically it adds some flexibility there for you. A lot of people back in time were also using Proviron during post-cycle therapy, but studies have shown that it is slightly suppressive. So it might be something that you might not want to do. Now, in 4 weeks, that's debatable. I've seen people use it in post-cycle therapy plenty of times, 4 to 6 week post-cycles, and show blood work and recover well. But it's something that you might want to consider. There's really no need to use it in PCT at all. I'm not going to tell you that it's absolutely, positively something you should never use. I don't generally sit here and recommend it either. You're not going to see me ever lay out a post-cycle for somebody and put Proviron in there. People ask me if they can use it, and I kind of say, well, that's kind of a gray area. That's up to you. I don't personally recommend it. I'm not saying that it's no way, no how, because I've seen otherwise, but like if you're asking me, just any normal question on the forum, email, I'm going to tell you no. So, basically as a result of this, high Proviron dosage can possibly prevent the pituitary gland from recovering after a steroid cycle. Some people do insist, like I said, that it doesn't suppress during PCT or during a bridge, but it's just debatable. There is a side note here. Some studies do support long-term use of Proviron at high doses without serious suppression. The science is there in some cases and it's not in other cases. So it's one of those things where it affects everybody differently, basically. So moving on. because we have Aromacin, Arimidex, Letrozole, Proviron should be obsolete in terms of people even thinking it's an aromatase inhibitor. I rarely see it anymore. I do see it. A lot of old school, users will still have that in their head. But generally, I don't see too many people asking about that. But I want to make it clear. So, it doesn't mean that Proviron doesn't have uses on cycles when using aromatizing compounds like D-bol, though. Testosterone, DECA to a small extent. A user can expect to have a harder look, more vascularity, and less puffiness when they use Proviron with anything, especially with a wet compound. So it does have benefits there. Now, another benefit of Proviron is that it binds very well to SHBG, which is your sex hormone binding globulin, which is the hormone responsible for reducing free testosterone circulating in your body. And this is probably the reason why some people do use Proviron during PCT. One of the things I say about Proviron that I like about it so much is this thing that it does, like I'm saying, it will lower your SHBG, which in turn frees up bound testosterone, and by doing so, indirectly, it's allowing you to gain much more. It's not going to have a direct effect on your muscle size. So Proviron itself is not going to go out there and make you gain 5 or 10 pounds. But by freeing up bound testosterone, it's going to allow you to get more out of what you're doing. So if you're running a cycle, I don't know, let's just throw out a basic cycle. Test and D-bol, okay? And you add Proviron in there, you're going to allow yourself to get more out of it because you're freeing up bound testosterone, which is going to allow you to gain more size and mass. So it has its role. It's just like on an NBA team when you got maybe a player that all they do is their specialty is defense. Well, you need that guy to win the championship. Okay? Of course, maybe they don't have any offensive skills whatsoever, and you're not going to look to him to score, but that defensive hound is going to get you what you need. One of those dogs that you need to scrap and fight and win. It's kind of like the San Antonio Spurs that don't always have all the talent, but they always win. At least they were. It's kind of like the Patriots. Well, Proviron is like that. Proviron isn't the answer on its own, but it's part of the team that's going to help you to get over the top. And that's one of the reasons I love it so much. Because the side effects are minimal and it can add so much to your cycle. People will say, well, I don't feel like Proviron does anything, but you got to understand what Proviron does. If you understand what it does, then you can see how it works. But if you take Proviron and you expect this on the surface, then of course you're not going to like it. It works behind the scenes. So, other people too, you will appreciate the hardening abilities that Proviron has because it will add muscle hardening in there. People compare it and say it's an oral Masteron. It's not to that extent, so don't get confused in thinking that it's going to make, harden your muscles like Masteron, but it does have these properties. All right, so it's going to give you a drier look. Now, it doesn't have anabolic properties, so you have to understand that. So you definitely need to stack it with other compounds. Just running it on its own, you might get that libido boost, because of lowering your SHBG, but you're not going to get a ton of other, things there in retrospect if it's just being used on its own. Now, let's talk about side effects. Since Proviron is such a pure DHT derivative, we can logically say that it comes with side effects, just like any other anabolic steroids, but the side effects, that come from it, is because of the DHT characteristics. So you can expect maybe, if you have male pattern baldness issues in the past, it could potentially, speed that up or give you some hair loss shedding issues. If you don't, chances are very slim that you're going to have that. It can also enlarge the prostate, but this is generally only in people that abuse it. And it's not C17 alpha alkylated, so liver problems should not be an issue with it at all, nor blood pressure, nor kidneys, nor anything else like that. Now, the half-life of Proviron is around 12 hours. Good recommended dose is between 25 to 75 milligrams. Generally, if you ask me, I'm going to tell you 50 milligrams. All right? I never go over 50 milligrams, but I don't go under that either. The detection time on it is 5 to 6 weeks minimum. So people that are tested often, you might want to avoid using it. Females are not, and I repeat, females are not advised to take Proviron because of the DHT properties being so heavy in it. Side effects can be unpredictable in females, and so I've always told any female that's asked me, don't do it. Just don't. So that's Proviron, everybody. I hope that covers it for you. I hope everybody got a good grasp on it. Something I really like to discuss, so I definitely enjoyed doing this one for you. So That being said, www.icearms.com/forums. I'm also on the Evolutionary Forum as well as the Elite Fitness Forum. Dylan@icearms.com. Get me with all your questions and comments. And please don't forget to subscribe to the channel. That being said, stay tuned for plenty more to come. Dylan Gemelli signing off.